evening. I hope you all enjoyed the refreshments in the lobby outside of the lecture hall. And welcome to the 4th annual Thiel College White Coat Ceremony. This event is for the Physician Assistant Program class of 2026. I'm Dr. Jim Tasick, the Program Director, and I will be the Master of Ceremonies this evening. This event marks a rite of passage for these students to become healthcare providers. Our cohort of 40 students has successfully completed one of the more demanding challenges in PA education, completing most of the didactic year. This entails learning to assimilate an enormous volume of information in order to practice medicine safely and become lifelong learners. Several analogies have been used to describe what it's like to learn as a physician assistant student. My favorite is, it's like trying to take a sip of water from a fire hose. When I try to describe what it's like to be a student in a PA program, I use the word grueling, but I'm not exactly sure that adequately describes it. Indeed, these students have realized that although we try to explain and prepare them for the rigors of a PA program, they will all agree that they genuinely do not understand the meaning of it until they have lived through it. Now they have completed enough training that we will send them out to interact with actual patients, and to do that we will cloak them with the symbol of professionalism and trust, the white coat. I want to introduce our administration and faculty members to you. President Susan Traverso, Vice President of Academic Affairs, Dr. Sheila Nowinski, Dr. David Schellenbarger, our Medical Director, Jessica Sloan, our Director of Didactic Education, Allie Andruski, our Director of Clinical Education, Dr. Dan Dankovich, Professor Jennifer Schellenbarger, Professor Mary Honard, Dr. Greg Hellier, Professor Brittany Gladys, and Dr. Omar Malik. And I want to personally thank all the faculty. Now I want to call Dr. Nowinski to the podium.
Thank you, Jim, for that great introduction, and welcome families, friends, welcome students. It's wonderful to see you here and to celebrate with you today. As Jim introduced me, my name is Dr. Nowinski. I'm the Vice President for Academic Affairs and Dean of the College, and I started in this role in January, and it's really been a great pleasure to work closely with the PA faculty and Jim, the Program Director, to learn more about this wonderful program that we have on campus. Today really marks a big transition for you students as you move from the didactic phase of the program into your clinical education. So closing a period of really intense, rigorous study, countless hours of preparation, and the white coat you receive today really symbolizes not just your academic accomplishments, but your readiness to apply this knowledge now in service of others and in the community and to your patients. So this is the moment where you're going to transform this theoretical knowledge into practical wisdom. You'll witness the art of medicine now that you've learned and mastered the science of medicine. I want to really take a moment and recognize the exceptional PA faculty once again. These are really dedicated educators that have guided you through really difficult, challenging coursework, complex concepts, really demanding standards. And it's not just their dedication to academic and educational excellence. Their commitment to you and your development extends far beyond that. I know that you know that as well. I think it's really embodied in the blood drive that you're all organizing that's happening in the next couple of weeks. And it's just a commitment, I think, from your faculty and you as a community to the kind of the mission of our program, right, to serve the communities and that you're embarking upon. So I wanted to recognize them, and again, what they're modeling for you as educators and as practitioners. So I would say, like, as you're moving into this new role and moving into the clinical phase, like, look to them as your models for that. Look to them for the models of care, of humility, and of learning and growth. And you'll if you do that, I think you'll do really well. Congratulations on reaching this milestone. Congratulations, families, friends, supporters. I know it's been a road for you as well. And I really look forward to hearing your success stories and hearing all what you learn when you come back. So congratulations.
Thank you, Dr. Nowinski. I'd like to now introduce President Traverso.
Faculty, proud family members, friends, and most importantly, these outstanding students, it is just such an honor to celebrate this day with you. You know, Thiel College was established here in Western Pennsylvania in 1866, almost 160 years ago. But it was really only in the past decade that we began to say, how can we serve this region, not just by producing high quality, well-educated, broadly informed undergraduates for a range of careers, but how might we do advanced education and serve the needs of this region, yes, but also regions across the world. We are at a time where healthcare is in demand. We need to, as educational institutions, meet that need by creating opportunities to attract really bright, talented graduate students to a setting where they can learn and grow. And so now in my 9th year as president, and in the 4th time I've seen this white coat ceremony, it gives me great joy that Thiel is still very much that college that was founded by a group of Lutherans, now open to all, in 1866 and going strong. And so students, this time at Thiel, you have built, I think, a foundation that will ground you, that will hold you firm as you go on and grow in your profession, including your clinical studies, but then on from there. But in addition to knowledge, I know, because I do watch, I peek down into that first floor and I see that you've also established friendships and strong networks of colleagues with each other and with your professors. And those networks will carry you through the beginning part of your career, and I think our faculty would say those colleagues you form in graduate study carry you honestly through the rest of your life. And so today, as you receive your white coat, remember this. This coat is both a symbol of your accomplishments, but a symbol also of the promise. Your promise to uphold the ethics of your profession, the promise to be a lifelong learner, and the promise to serve your community with humility and respect. So on behalf of everyone at Thiel College, the Board of Trustees, and myself, I want to say how proud we are of you. Congratulations on this milestone. Welcome, I think after a few more weeks of didactic, right, to the next chapter of your journey, this journey to become compassionate, skilled, and extraordinary PAs. Thank you. Please wear this coat with great pride, as much pride as I have in each and every one of you. Congratulations.
Thank you, President Traverso. Now I'd like to present you with the history of the white coat. The end of the 19th century brought about some changes to science, particularly medical science. In the 18th and early 19th centuries, physicians, pharmacists, and other medical practitioners were viewed with skepticism. Most medical treatment was thought of as nothing more than quackery and mysticism. The physician could do little to relieve pain and suffering, and their advice was sought too late to be of any use as the person was nearly deceased. The garb the physician wore was the same as the clergyman, who was usually also in attendance. A black coat was worn as a mark of a solemn occasion, one of formality and to pay honor and respect. Western medicine had an image problem. About that time, the Industrial Revolution was in full swing, and with it brought respect for science. The lab scientists of this time would wear their lab coats, which were usually gray in color, but would protect the person in their clothing while experiments were being conducted. To signify that medicine was a science, the medical profession gradually adopted the lab coat as a symbol of the change that was occurring. At about this same time, the contributions of Joseph Lister, the father of antiseptic surgery, were being widely accepted, and the use of the white lab coat became the symbol of cleanliness and medical science. The white coat is viewed by many as the cloak of compassion. To the traditionalists, the length of the lab coat signifies the wearer's position in the medical hierarchy. The long coat signifies a graduate licensed practitioner, while the short coat or jacket signifies that the wearer is a student. Some institutions go as far as to have the student wear a jacket and a resident or intern wear a 3/4 length coat, and fully graduated practitioners would wear the full-length lab coats. While some institutions are strict followers of this tradition, others have all providers wearing short coats or jackets to signify that in medicine, we are all lifelong learners. As each of you receives your white coat, your journey of treating patients in the medical profession begins. The white coat reminds us of our professional duties as prescribed by Hippocrates, to lead our lives and practice the art of medicine in uprightness and honor. Wash them often, avoid stains, and consider having a spare coat available for that morning when you spill your coffee. Students, if you would rise and exit. I now invite Professor Gladys to the podium to read the names of the student names for the donning of the white coats.
Benjamin Byers. Ashley Chambers. Peyton Eckenrode. Sarah Ghazi. Gabrielle Geinzer. Ryan Harcourt. Chloe Herman. Mustafa Husseini. Leah Jensen. Grace Jones. Hannah Jones. Alexander Campo. Jasmine Lee. Charlotte Lister. Alicia Lynch. Lauren McCleary. Connor McInnes. Anna Paul. Caitlin Augustine. Renee Muskie. Randall Miller. Hannah Mueller. Carly Orcutt. Safa Paracha. Fatima Blagman. Alexandra Steele. Devin Thomas. Lydia Webb. Mitchell Williams. Nazifa Yar. Gabrielle Yunez. Abigail Bernhardt. Ashlyn Randolph. Elisa Rocha. Karina Rogers. Juliana Sloan. Jacob Smith.
Let's go, dude! Come on, man.
Stephen Smith. Victoria Young.
So can we have another round of applause for all of us? The students will now perform the physician assistant student pledge in unison, led by Professor Jennifer Schellenbarger. Will the students please rise?
So first, I just want to say, congrats to all of you again. I can't tell you how proud I am of all of the hard work that you've all put in this year. And so when we read this oath, I know that you all embody the spirit, as I said, you transition to your next phase of education. So congrats again. But here we go. All right. As a physician assistant student, I pledge to maintain the highest moral and ethical standards. I will adhere to the core humanistic values of honesty, integrity, altruism, and empathy. I will hold in confidence the information shared with me by my patients and providers. I will show respect to my patients, preceptors, other providers, and medical staff at all times. I will recognize and promote the value of diversity and regard equally all persons I interact with, whether patients, providers, or medical staff. I will strive to improve my medical knowledge and skills, understanding both my capabilities and limitations. I will work with other members of the healthcare team to assure compassionate and effective care of patients. I will act under the guidance and supervision of the physicians and preceptors with whom I work, except where to do so with qualification and harm. These duties and responsibilities I hereby pledge with sincerity and on my honor. Well, we've come to the conclusion of our program. I want to offer a special thank you to our administrative assistant, Faith Winter, and also Professor Sloan for coordinating and putting this ceremony together. I also want to thank you all for coming today to help make this event memorable for our students and for you, their families and friends. As we conclude, I ask that the audience please clear the center part of the room so the students and faculty can stay up in the front for pictures, and then the students will be free to leave. Have a great evening, safe travels, and thank you again for coming.